Welcome to the Reboot Show. I'm Sally A Illingworth, your host, and I'm excited because today I'm here with Amy Smith and Luke Stow to have a discussion around what the future of medicine and patient care looks like. So I'd love to start with you, Amy, and hear your thoughts on maybe during this time, during the COVID pandemic. Obviously there's been a lot of shock from all angles. And I'd love to hear from you what your thoughts are on maybe some of the changing dynamics from a patient perspective when it comes to interacting with healthcare facilities.
Yeah, it's been a really interesting time, and I think what our normal has been is definitely not normal anymore.
Yeah.
And so I think it's been a real shock to the system because our natural reaction is, if you feel sick, you go to the doctors and you go and see them in person. We haven't been able to do that. So I think it has really pushed people to think differently around
There's probably been a
how
lot
they
of
get their
fear
healthcare.
as well around
Yeah.
going to a healthcare facility,
Totally,
right?
Totally. Yeah, no one wants to. Like, we're being told to stay at home, so that's what you did, and it was, no one wanted to get sick, so no one wanted to go to the hospital. That was the reality.
Yeah, I actually remember reading at one point that in some countries people were sort of avoiding, say in the US, going to healthcare facilities because of the cost implications if they were sick or they did have COVID. Luke, from your perspective, what have you been seeing from a healthcare facility sort of operations and management standpoint in terms of some of the changes they've had to make during this time?
Yeah, it's really interesting topic. One of our clients is a hospital precinct, and the changes have been quite phenomenal in terms of just the way their employees have been impacted by the COVID virus. So, if you take, for example, just schooling, if all the children were sent home from school, then half of the hospital system, in terms of workforce, would have been off work looking after children.
So that's why schools didn't necessarily close, because I know there was a lot of controversy around that. Well, why don't schools close? So it was because of the impact it would then have on the healthcare system from a resource standpoint.
Absolutely. You can imagine half the employee base of all the hospitals in the world, where they've got children at home. And they have to go and look after those children, so they're not then in the hospital system. So it would have put a huge drain on the resources of the hospital systems globally if that was to occur.
So do you think many of the healthcare facilities, or at least the ones you've had the opportunity to maybe be exposed to, do you think they've been in the position where they were sort of tech ready enough to, one, retain their resources to help with the situation, but they had enough tech infrastructure in place to be able to support people at the scale they needed to?
Look, there's two probably conversations there. The first one is to say, no, I don't. I think that most hospital systems were overwhelmed with the prospect of having these amount of patients in ICU, absolutely.
No one saw this coming.
It's unprecedented.
Yeah.
So basically, they don't have enough emergency beds to look after the amount of patients that were coming in and that were very ill. So from that regard, no. I think from other technologies that are in place, which is consolidating electronic medical records, where you're starting to get consolidation of medical records throughout hospital systems and then throughout precincts and then throughout geographies. I think that type of technology is definitely going to play a positive role in helping with this type of scenario.
So is that sort of tech commonplace anywhere in the world, to your knowledge? Because I would imagine during a time like COVID, to ensure that the patient healthcare side of things is managed as best as it possibly can be, and patients are kept informed so that maybe they can decide as to whether or not they're going to a healthcare facility today and so forth, and what the best healthcare facility is for them. During a time like this, we need access to that information at scale across the globe, because this has required sort of like a global collaboration between governments to understand what's going on. So is it commonplace yet or no?
Look, let me kick that off. I think there's a few topics to this. I think what we are seeing within the medical industry is definitely a concentration on helping people live longer, better, healthier lives, which is really quite a key thing from a people point of view. That's what we all want. But from an industry perspective, there are many different technologies that are starting to come into healthcare across the globe. So some of those are around, augmented reality. Some of those around virtual reality. I mean, we are seeing now that there is much more of gamification in some ways of some of these technologies.
So what's an example of how that's used?
Well, for example, you know, looking at repairing physical disadvantages, like from an eye point of view, that's sort of now taking on an augmented virtual reality perspective where, you know, the eyeball actually becomes a map, and there's technologies that can drill, you know, right into the detail of, you know, an eyeball, an iris. And
sounds so out there.
And then basically
Do you think people are ready for that from a patient standpoint?
Look at being able to model that, and then, you know, we're even moving to a direction where those physical disadvantages can be turned into like a superpower, where you can get the eyesight of an eagle, you know, through the technologies that are now available to help you, you know, get through those physical disadvantages. And that's just the beginning, I think, of what we're starting to see come out from a tech point of view. So it's all pretty good from a perspective of helping us live better, longer lasting, healthier lives.
So in terms of delivering patient care, on that note, and those sorts of tech advancements that are likely to change the industry, and they already are in some cases potentially, even if it's in a trial sense, do you think people are ready for that, Amy? Like, do you think people are mentally, emotionally prepared to be in a hospital setting where they've got those sorts of tech solutions helping to look after them?
Yeah, it's a really interesting point. I would have to say probably not. Like, even from, you know, me as a millennial, I'm like kind of like, wow, that's pretty out there, you know, because I'm not in that space. I'm not working in it every day. So I think when, you know, you are, it's kind of feels quite natural and normal. If you're the people working on these solutions, like, that's awesome, right? And it's really, really good work. But I think we've got to remember that we've got an aging population. And I think the more, you know, these older generations are probably taking it the hardest. Like, even through COVID, you know, I was thinking of my grandparents that just needed to go to their local GP and pick up a script. And for them to not be able to do that and not know how to access these telehealth, you know, enablements that we have now and all these sorts of different solutions, I think it's a harder jump for them to start with. I think the younger generations usually have a bit more of an advantage because I guess they're more open-minded to the tech solutions. But I'm not sure, you know, from a patient standpoint, we can have that real concept around being in hospital and say, you know, having a robot in to check that we're okay. Like, I still think that's a little bit of a stretch.
It's probably quite confronting, particularly during a situation where you require healthcare support, because you're in a very vulnerable state, and then you have this robot come up to you and help you.
And I think we need to not forget about that empathy that we need, you know, as part of that healthcare for patients. You know, having that human-to-human contact. It's pretty important when you're not feeling your best and you're not really in that right space where you normally are.
Yeah, no, I'm envisaging like R2D2 now coming over to me and trying to shove a thermometer somewhere. It doesn't sound it doesn't sound really.
I think that's where everyone gets to. There's nothing in between. It's like 0 to hero. Yeah,
look, people will start to get used to this fairly quickly, is my view. You know, particularly I think coming out of COVID where you know, not all technology changes are for the benefit of us. You know, I think what we've seen with COVID, not saying it came out of a lab or anything, I don't want to alarm anyone or get any phone calls from any government.
We'll ask you about that on the next segment.
But let's keep that offline. But one of the things that I do think about is that with technology advancement comes the risk of new disease and new viruses, because what we're talking about is scientific advancement as well. With looking at all types of things, you know, such as genetic mutations and looking at how we can change genetics moving forward, because that can help, but also it's got a flip side to it. So I think we just should be mindful of that. But the E-enabled patient is what I wanted to position.
And what's that mean?
What is
Glad you asked. Enabled, empowered.
Did you do your homework for once?
Of course. The electronic empowered enabled patient. So what this means is I think patients get more capability. Patients are enabled, or patient empowerment, let's put it that way, will mean that we'll have access to our data. Will mean that we'll be able to see what's been said about us right through the history of our medical records being kept. And I think that's a great thing.
Does that mean I don't have to rely on Dr. Google and then, like, before I go into the doctors, I've already, like, diagnose what it is, and I go in and tell the doctor this is what's happening?
Yeah, that's probably.
So you've become a more informed patient, which helps the healthcare system. But on that point, with these advancements in tech and being more informed, having access to your own data, what risks come with that though? in terms of having this consolidation of healthcare data, which is quite sensitive in nature. What risks does that potentially pose to the healthcare system and those organisations, to the patient, to governments?
I think one of the things that I've been particularly interested about is, security, cyber security around medical data is one of the highest cybersecurity areas that there is. And the reason that is because it's so valuable. Yes. It's so valuable for governments to be able to get hold of another country's data about the medical condition of their people.
The other side of that, which is quite difficult, I think, in some cases to even fathom, there's the benefits from a government standpoint in terms of being able to make better decisions from budget allocation perspectives and so forth. But the other end of the spectrum is the fear there when you hear commentary around the fact that we're moving into a world where bio-warfare is the new warfare. So having access to those data sets, if you like, can be quite daunting, I would think, from a patient perspective potentially.
From a consumer point of view, I guess in the world that we're living in, from my point of view, I just think that everyone knows everything about me anyway. Like, I don't feel like I have a lot of control over the data that's out there about myself, whether I wanted to or not. And that's just my take on it, because if you're on Facebook, if you're on, any of the social media channels, they're listening to you. Like, people don't realise this, but there is plenty of things that they would know about me.
Well, I know I have Siri disabled and Siri still listens.
Yeah,
I know that.
Yeah,
I know that.
That's right. So, like for me, I'm kind of, maybe that's just throwing my hands up and giving up about it, but that's just the way I feel.
Yeah, I think that would be a very common feeling from public, would be that everyone already knows. But the important thing here is that now the patient's becoming more in control of their own information rather than someone else holding that information and not sharing it. So from the perspective of being able to look at your history and look at your family's history and understand all the dynamics of that, and being able to work with the clinicians and the medical practitioners to be able to help you understand that information, and for them to have access to that. Not give you the wrong drug when you're in a car accident, you turn up at the hospital. Accidental death, is something we've really tried to, really stop from a medical industry point of view. These technologies will really help that. And I think there's a fun side to this as well. I mean, we always talk about the serious stuff, and I think the fun side of it is, I was reading an article where 3D printing, for example, the use of 3D printing to create pharmaceuticals in the shape of dinosaurs or fish for kids. There's a practical and fun side to this which I think can be adopted as well. And people will say to me, Luke, pharmaceutical companies are not very fun. But the point being is that for children, I think this technology advancement, and for the elderly, I think will make a big difference in just the way they experience the care that happens as well. So for me, I think it's a really great positive, and I'm looking forward to more.
I'd love to hear what our subscribers think around, add a comment if you're worried about your data, or if you're not worried about it. Like, it'd be really interesting to see people's own personal opinions about it.
Yeah, or if anyone has had a bionic eye or something, I'd really like to get in touch with you.
We want to know. We want to know.
We look boring with glasses.
Yeah, I'd never look boring, but yeah, okay.
Well, I'd beg to differ, but on that point, so having access to all of this data, whether or not the patient has a significant amount of control over what data is retained about them, and the right to be forgotten and so forth, what does this data, if you like, mean for policymakers and so forth? What capabilities is it going to give them in terms of being able to develop models to then better understand the data at scale and make decisions that are considerate to a country?
We've had this conversation before. I think this is a case of data rich, insight poor. There is, I'm sure there's gigabytes, terabytes, whatever the largest scale is. Can't remember. I should be in
technology consultant.
But like basically saying that, look, we've got as much data as we can store around medical history. But I think it's about what's important in that.
Like, how do we create meaning out of it? It's all right to have a bunch of numbers thrown out there, but what does it actually mean, and how do you make better decisions from that? I think that's the part, to Luke's point, that we're kind of missing.
And I think the clinicians and practitioners in this space, the technical people, the doctors, the nurses, they could really help drive this and make it a real meaningful a meaningful exercise to bring the data out and to actually help with what would make patients' lives better, and how can we make people live longer, and what can we do about passing that information on to all other industries that may find that useful. I think this is the thing about data, is sharing it across industry and not just holding it within the health care system.
But I think there's a major mindset change that needs to occur there, particularly because that thought is quite new to the healthcare space. At a leadership level, and I know we've spoken about this before on the show in terms of managing change, bringing people along on the journey, what would you say are some things that leadership can be thinking about to try and better manage this change and this sort of tech evolution for the healthcare industry, to make sure that the professionals in that space who have gone through tertiary education for years, they've been practicing it for years, they're really emotionally connected to their work, and now in some cases technology is going to become a bigger part of that, and I think for some of them it could potentially be quite confronting. So what are your thoughts on how leaders can manage this diligently and with a lot of empathy in the healthcare space?
Yeah, I think it's really about looking at it as adding value to the work that you're already doing and assisting you as well, because I think there's a lot of people, particularly nurses and doctors, that are kind of in their flow, have been doing what they've been doing for years, right? And that experience of that knowledge is invaluable, right? But it's about allowing some new insights to come in, and it's allowing different ways to work. And like you said, that can be quite confronting, right? Because if you're used to your routine, you're used to what you're doing, you have, I guess, a lot of instinct when you're working in those fields too, from your experience.
And it's quite a sensitive profession, really. In many cases, to something you mentioned, you're dealing with, in some cases, life or death. So I think there's probably a lot of fear for some of those professionals around maybe letting go of some of that work or some of the tasks and allowing tech to play a bigger role.
Yeah, it's a trust factor as well. It's like, I'm already good at what I'm doing, so how is this going to help me and enable me, and not see it as a hindrance?
I always say this, and I feel strongly about this industry around this comment, is that it's not about the technology, it's about the people. And I think from my point of view, they have to be at the centre of all that's evolving here. We have to make sure that the clinicians, the doctors, the nurses, the people who are working in this space have a really firm grip on what changes are happening. And it's not being done to them, but they're part of it. I think that's really crucial. I think the patient needs to feel the same way as well. And we're going to have circumstances now where workplaces, we haven't talked about mental health, but that's critical, right? Workplaces where fatigue is really important. And if you think about that,
we've seen some quite confronting content come out amid COVID from healthcare workers, where they are talking about the pressure that they're under.
Absolutely. And that pressure is huge. So employers will start to put in much more around mental health. How can we help people in the workplace? How can we support people through their lives, as their lives and livelihoods are changing? What can we do about supporting our customers? So you see retailers starting to put medical and health care type of operations within their precincts. I mean, this is going to be part of the attraction of it actually going into a retail store in the future, is there'll be medical checks that you can get done while you're doing your shopping.
And do you think people want that?
I think we'll become used to it.
Yeah, I think we'll get used to it, because there's no sort of work-life balance per se anymore. Like, it's an integration. There's work-life integration. We're all working from home, or we're doing different things, and I think we have to start thinking differently about where we get these services from. So if it means going into a shopping centre and being able to get my health checked at the same time, I think that's a convenience thing as well.
I think we've just had one of the most amazing change management experiences to mankind in the last 100 years. I think it's 100 years. So we've just been through this massive change management exercise where we now have come out the other side, and we're now feeling, well, we have less human contact. We do more online through devices. We do more through about health. So we're going to become used to this.
So as we're starting to come out the other side of COVID, at least in somewhat of a strong position in Australia. So what are the key takeaways from not only this conversation, but that broader topic around healthcare and the relationship between the healthcare system and technology? What are the takeaways for the audience?
Well, I think one of the key ones is, get used to it, because I think this is going to be much more of a commonplace discussion that we're having now, that families and employees and employers will start to have. And I think the advancements, we have to go with it. I think this is the future. So we need to plan how we can coexist, co-create this new environment we're working with.
Yeah, and I think, no one asked for this to happen. It has happened, and there's going to be that transition period and a lot of fatigue, like you mentioned. Like, there's a lot of people that have been very, very affected by this, through the healthcare system. So there will be that sort of slow and steady sort of uplift to get back to normal, but it's not going to be normal, it's going to be the new normal. So it's really about moving forward and making sure that, everyone is good through that process as well.
And I think the last one, Sally, is we need to be careful here with making sure that, there's these mad scientists out there that want to just use the technology for slicing and dicing, these types of viruses and experimentation. We just need to make sure we're really careful.
Well, I think we could have a great conversation around things such as CRISPR and LEPA technologies, which really are the future, to your point earlier, around gene modification and so on.
I know how much you love that, so let's not do that
today. I get excited. Thanks so much for joining me on the show, guys. I hope you enjoyed this conversation. I certainly did, and we hope that you all enjoyed this conversation around what the future of medicine and patient care looks like. Please do make sure that you subscribe to the Reboot Show YouTube channel, and we will see you on the next segment.